Good Tuesday morning to the nation's oldest city. Good morning, happy new year, happy everything. First show this here in the new year. This is Christian Ramos filling in for Chris Phillips once again. Thank you for tuning in. I'm joined today with friend of the station, friend of the show, Dr. J. Hartley. How you doing today, sir?
Good morning, Christian. Happy New Year.
Happy New Year. That's right. I didn't even say that when you walked in the studio. How was your New Year?
Awesome.
Yeah, would you do anything special?
Very good. Watched the fireworks at the beach, and that was pretty cool. Some friends of mine brought the glasses, kind of like they use at the downtown lights.
Yeah, get the
But
star
with the
show
fireworks, that was pretty cool.
Oh,
so
nice.
everyone that went off, you actually saw like 9 of them.
Nice. That's,
So
that's actually really cool. I didn't think of that.
it was pretty fun.
I didn't think to do that. The beach blast off was really fun. It's just the same thing. I mean, not the same thing. Well, yeah, it's the same thing. They do
We
every year,
watched
but it's
it
really
a
nice.
few miles down on just a catwalk.
Okay.
on, like,
Yeah, we
Second-
actually went
Second
down
Street.
to the pier. It was crowded naturally, but it was nice. They had like the whole little, I guess, a fair almost to a degree. They had a little like funnel cake here and there. They had
Yeah, it's crazy down there.
yeah, it was a lot of fun. And then they had a whole stage set up. I don't know if that's the first year they had done that or
They normally have the stage.
do they normally have a stage? Okay,
Yes.
I couldn't remember from years past, but we were there, and the prom kings were there on stage, and they put on a great performance like they usually do. So it was great. Not to ring it in the next decade, honestly. So, but we're trying to start off the year strong here. But it was fun. It's great to be back in the studio with you, Doc. I know last month now it's been about a month. We talked about pretty much everything that you do at the Hartley Chiropractic and Scoliosis Center. Everything was pretty new to me, so a lot of it was mostly teaching me, and your normal listeners, I'm sure, it was nice to recap for them. So I'm sure we'll touch on some of that stuff today. But I know before just a minute ago, before we went on, you mentioned that you guys just started a YouTube channel.
Yes, we're doing some YouTube videos, but we'd really like to do a live broadcast on YouTube. It requires 1,000 subscribers. So if you're on YouTube, you go to Hartley Chiropractic and Scoliosis Center, hit subscribe. When we get to 1,000 subscribers, we'll do a live health and wellness show and all different topics of health. And we're really looking forward to doing that and hitting that milestone in 2020. And we might even do some of the shows from the WFOY studios.
Oh, watch out! Just people helping people out here. I love it. It seems like we're stepping into the new age there at Hartley Chiropractic, because we're joined with hopefully folks on Facebook Live as well. Really, just taking advantage of all the media options.
If you go on to Hartley Chiropractic and Scoliosis Center Facebook right now, we're doing a live broadcast of the radio show, so you can see Christian and I.
You can see us here and ask us questions in real time if there's anything specific to you or to any loved ones. If that's the type of situation, definitely tune on in and ask you the questions. And I'm actually continuing on the YouTube channel. I want to hammer this one home real quick because it's a great opportunity for you guys to keep moving forward. You guys have a few videos up. Have you touched on anything specific? I know I see one of the videos says the cold and flu myth explained.
Yeah, well, one of my pet peeves is the cold and flu season, and it's really the Halloween, Thanksgiving, Christmas party, New Year's Eve season, and people run themselves down. Just lack of sleep, too much white flour, too much sugar. The immune system goes down, and then the germs take advantage. So your body's all about internal resistance. When your internal resistance is high, you don't get infections. When your internal resistance is low, you get infections. So if you stay up all night with white flour, sugar, and alcohol, and you wake up the next day and you have the flu, it wasn't some bug that attacked you. The bugs are always there. It's just a matter is your resistance high or low.
Right.
So we get into that a little bit. It's a good little video.
Yeah, I see it. I like it. That's old. That's past you. That's old. That's new year, new me. So it's not none of those things.
Yeah. So this year it's a new year, and we really want to focus this time of year. We have a lot of seniors in town, and a lot of people are suffering from chronic illnesses, and they don't realize that they could be related to their spine. In seniors, only 5% of teenagers have scoliosis, but 60% of senior citizens have scoliosis. So there's many seniors out there that have progressive degenerative scoliosis that may be causing them low back pain, hip pain, leg pain, and they don't realize it's related to the scoliosis. And many times we help to stabilize and improve the scoliosis, and those symptoms go away.
Very nice. So then, is the process any? Because I know when we talked last time, in terms of the teenagers, that type of when you notice it that early, you look for things towards prevention, and you take those steps. But is the process different from that? I assume it is between the age.
Yeah,
difference.
it's kind of, in some ways it's the same, because ideally the best corrections are made before somebody goes through puberty. So when we have somebody that they've had an early scoliosis discovered at 8, 9, 10 years old, that's the easiest time to correct a scoliosis.
Mm-hmm.
When you go through puberty and all the growth hormones kick in, then it kind of locks the bones into place and makes it harder to make a correction. So our goal may be a little bit different. The goal may be to reduce the curve or to prevent surgery on those patients. Where if 8, 9, 10 years old, many times we're able to reduce it to where they don't even have a scoliosis. Now, the surprising part of the diagnosis, though, can be similar in a senior citizen. So most people discover scoliosis around 6th grade, 7th grade, when around the time of the first menstrual cycle. Scoliosis is more prevalent in females, 80%. And when spring break comes around, when we go to the beach, all of a sudden the parents notice a rib arch, or they'll notice when they watch their daughter walk from behind, they'll see one rib humping or one shoulder really higher than the other, and they didn't notice it the summer before. So they're just like, wow, how'd that happen? Well, because these things can progress very quickly.
Wow.
So from the time you go from 10 years old to 12 years old, you can go through a lot of changes. And so the pediatrician may do a standard scoliosis screening, and it may be negative when they're 10 or 11. And then when they're 12, it may be severely positive, and they're referring them to Nemours for a consultation or ordering an x-ray. And many times we call in research the bending forward test, where they look at the rib arch, which is also, you can do it at home on our website, drjhartley.com. It teaches you how to do a home scoliosis screening, and you'll see when you bend forward, if you have a scoliosis that's over, let's say, 20 degrees, you'll have a rib arch. And so in research, they call that rib arch test the too late test, because by the time you see it, it's already gotten severe and you're already going out for a surgical consult. So it'd be better to refer that earlier. So when we do a scoliosis screening at a school, which we're doing one at Veritas Classical Christian School on Tuesday next week, we screen everybody, kindergarten through 8th grade, because it'd be better for people to know sooner than later, if there's anything suspected.
Of course. And
now in adults, the diagnosis can be just as surprising as a 12-year-old.
Okay,
so somebody may not know that they have scoliosis. So let's say they didn't have scoliosis as a child, and then they go in to get a chest x-ray or something, and they're 65 or 70, and all of a sudden the doctor says, hey, did you know you have scoliosis? Well, they didn't have it as a child, but what they have is adult degenerative scoliosis. So you have one segment that's out of alignment, and all of a sudden it degenerates very quickly and creates this scoliosis. And so it looks a little bit different. You can also have scoliosis where they were diagnosed as a child, and maybe they had a 20-degree curve, but now they're 60 and it's a 40-degree curve. And so those are the people that, in both cases, the adult may notice all of a sudden one shoulder being off, or they're leaning to the side, or they've gotten shorter. They'll say, I was 5'7", but now I'm 5'5", and that happened in the last 2 years. Those can be indications of that happening. Or you're just, people will say, hey, I've noticed you're walking crooked the last, few years,
right,
if you haven't seen somebody in a while.
That's okay. That's pretty crazy that it can show up that much later. Because I know last time when we spoke, we said that you mentioned there was 3 theories that you had touched on that might result in that, in terms of outside traumas. That's something that maybe can't control. Hormones, and like you said, or genetics. And so I didn't know that's something that could lie. Is that something that lies dormant per se, or just kind of develops and generates over time?
Well, the degenerative scoliosis is really like one segment gets out of place, and then all of a sudden it degenerates very quickly. It's like one time I got a new set of tires on my car, and they didn't have them aligned properly, and I was going on a road trip. 200 miles into the trip, I had a flat tire. So it was really that alignment issue that generated that. We'll talk about it on the break a little bit more.
Yeah. So stick with us, folks. We've reached our first break, our first and only break, I guess technically. But stick with us here after the break, and we're going to touch on some more.
And we'll still be on Facebook Live.
Yes. So sit tight. We'll be right back.
Yeah. So what I was talking about with Christian is that with this adult degenerative scoliosis, you have two segments, one on top of the other, and all of a sudden one gets out of alignment, and then the whole segment creates that scoliosis. It can happen very rapidly in adults, so you may get an x-ray and then 2 years later get another x-ray, and it wasn't there 2 years prior. So we see this a lot in people like, let's say, 65 to 75. We'll see that happen a lot. It's called nouveau or degenerative adult onset scoliosis. And that's why you might have 5% of scoliosis patients, 5% of the population has scoliosis as a child or a teenager, but 60% have it as an adult, because you have two groups. You have the group of the small curve becoming a large curve, so they already had some scoliosis, but now as an adult it's worse. And then you have another group that has this nouveau scoliosis, where all of a sudden one segment degenerates and they have that scoliosis that wasn't there before. And that's like a total surprise to the person, because they're 70 years old and they never knew they had a scoliosis. Well, they never knew they had a scoliosis because they didn't have a scoliosis. It all of a sudden came on onset. And Christian was talking about the different theories. So one of the theories has to do with hormones. So that happens in puberty, but then it also happens in menopause. So as you go through more hormonal changes post-menopause, that degenerative process can go quickly. Osteopenia and osteoporosis can accelerate it. So you can see a lot of changes happen very quickly. Now, the good news is, symptomatically, those patients do really well. So it's harder to correct their alignment back to normal, but they usually feel better with the treatment. So they can get a lot of low back pain, can't walk very far, knee pain, hip pain. They may have tried PT or injections, and it's just not helping. And the reason it's not helping is because it's coming from the scoliosis. So and a lot of people are motivated this time of year. So if they went through the injections and the PT last year, they're looking for something new, and they don't want to go through the same stuff in 2020 that they went through in 2019 over again.
Dick, so does that for in terms of just the age difference in terms of adults and elderly, also, is that if someone that's 70 or 60 or 40 as opposed to a teenager, do you have to modify a program?
Everybody's different. Usually we don't have to modify it. A lot of the scoliosis correction equipment makes them feel better.
Okay.
So it's the actual equipment that we use is similar to the children and the adults. And we did have a request from one of the patients to do a Facebook Live video on all the equipment that we use, so we'll probably be doing that soon. So we'll put that on YouTube and Facebook. So if you subscribe to our YouTube channel, you'll see that come up. But it'll give you a better idea of all the stuff that we're doing.
Perfect. Just right on time too. Alrighty, ladies and gentlemen, welcome back to the show. During our break, if you're not tuned in to Facebook Live, Dr. J and I continue to talk about scoliosis and chiropractic care. You didn't miss. You did miss some stuff, so make sure you tune on in. Visit his Facebook. Go to Dr. Hartley Chiropractic Scoliosis Center. Log on in for the last segment of our show. Ask some questions. But we were talking more about what we left off on the actual radio show here, which continue to talk about. My question was, that you didn't really have to. You don't really have to modify in terms of programming in terms of the age.
Yeah,
difference.
we can modify it, but most of the time we don't. So the program that a 13-year-old will go through would be similar to a 65-year-old. Sometimes if there's a balance issue, we might not challenge the older person as much. So we either have them stand on a flat vibrating platform or an air pad, which is like a piece of foam,
Yeah, right.
or an air disc. So we can kind of modify it that way depending what their stability is. It's a brain-based exercise program, so it's challenging your balance. So it's a great way to prevent falling. It's a great therapy for brain disorders like Parkinson's and Alzheimer's and different things like that, and prevention of those things. We do some brain games while you're doing these exercises.
Right.
So the treatment is similar, but we do have the ability to modify if we need to.
I suppose.
Yeah.
Very good. And I was scrolling through the site earlier, and I was curious about the Scolibrace that's mentioned a lot here, and it's just kind of funky looking, this whole brace, and that's just, I guess, terms of more spinal alignment.
Standard medical bracing is just kind of squeezing your spine and hoping that the curve doesn't get worse. The Scolibrace is an overcorrective or supercorrective brace. So if you're way over to one side, it's going to bring you to the other side and kind of do a mirror image. So it's going to do a similar thing that some of our therapies do in the office. So let's say you have a right thoracic curve. It's going to actually try to create a left thoracic curve while you're wearing it. And then when you're not wearing it, you're in the middle. So we do it mainly on large curves. We'll recommend it, or if we have some ligament damage. So like in the adult degenerative scoliosis, there's something called a lateral lethesis. So it's where the side ligaments of the spine are stretched or torn, and the vertebra will slide straight sideways. So it's very hard to stabilize that except for surgery. A lot of the patients that we're seeing, they have a degenerative spine, and because of their age, the surgeons don't want to do surgery, or they can't guarantee a positive result. So the Scolibrace is very effective for these adult degenerative scoliosis patients. And, we've had a lot of them that I can think of. One that was unable to wash the car, couldn't do any yard work. He got the brace, and, he's doing 2 hours of yard work now without any symptoms with the brace. And it's very effective. So we do a structural scan of the body. So it creates a 3D hologram of the body. And then we send that information to an engineer in Australia with the posture pictures and x-rays and the three-dimensional hologram of the person, and then the brace is created from that.
Oh, so it's a personalized brace.
It's a very customized brace, yeah. It Velcros in the front. Normal medical bracing goes in the back. It's a very sleek. There's an array of colors. So, kids will wear them to school with like a sweatshirt on, and you can't even tell that they have anything on. A lot of the adult ones are more low cut, so the brace is kind of from the ribs to the hips. And a lot of people with adult degenerative scoliosis, it's mainly in the lumbar spine, so the brace only goes from like their lower rib cage to their hips. So, it's very accommodating for them just to wear. So you can get a patient that, let's say they could only walk 100 feet without having severe pain. Wow. With this brace on, they can walk 3 miles sometimes. Okay. So it can be a really life-changing thing that we add in for certain patients. Not everybody needs it, but we've had some really good corrections. And then we have other patients that may have a really severe curve, like a 30, 40, 50, 60-degree curve, and they're trying to avoid surgery. The brace is a big part of assisting in the correction.
Right. Okay. Perfect. Yeah, okay. Because I had seen that on the website, and I was curious, and I saw the picture, and it's definitely, like you said. I know there's a lot of like personalized options in terms of color and
yeah.
And
if somebody had previous experience with bracing, let's say 1980s back, it was very scary looking stuff. The old medical bracing that was used, the Milwaukee brace. And this is just a better brace. I feel like it's a better brace than the Boston brace, which is the standard medical brace that comes off the shelf now. It does a 3-dimensional correction, so the Boston brace actually makes your back flat from the side view, and it's very important to have a forward lumbar curve, a backward thoracic curve, in order to help with the scoliosis. And standard medical bracing makes your spine completely flat from the side, where you're supposed to have a thoracic curve and a forward lumbar curve. So the scoliosis brace is correcting you three-dimensionally, not just from the front view. On a medical treatment, they're only looking at the front view x-ray. Well, we're taking into consideration the side view x-ray also, and making that three-dimensional correction. There's some studies from Europe that show if you have the thoracic curve, posterior curve of the thoracics, you won't have a scoliosis. And so it's very important to maintain that thoracic kyphosis in a scoliosis patient.
Perfect. All right, and now I know we obviously you work with scoliosis, but you're also, the other half of your practice is chiropractic care, and I was curious about that because my knowledge, like anything else that we've talked about, it's limited, and I probably just picture just chiropractic. I think I know just like this, not stigma per se, but just that. And when you think of like, oh, back pain, like, oh, I need to go visit my chiropractor and stuff. So I know obviously it has a lot of its benefits in terms of like neck pain, back pain, and other things, other symptoms that it relieves. But I was curious about someone like my mother. My mother, she suffers from back pain and neck pain, and she's scared. She I don't know exactly what her doctors have said could be the cause of it, but they've recommended surgery, and she doesn't want that. She's like, don't keep the knives away from my neck, keep it from the back. That's no, don't even get close. So what are like the safety precautions, or maybe she thinks too much of it or so, but like in terms of your chiropractic care?
Well, all pain is abnormal pain.
Right.
But, if a patient comes in, unless you drop a bowling ball on your foot, your toes should hurt if you do that, right? That's normal. But to feel pain on a regular basis, that's abnormal. Okay, whether it's growing pains or pain that an older person has, or they just say, I just have arthritis, there's no just about pain, okay? Pain is a sign of the nervous system not working properly. So something is going on. Now, if a patient brings in their MRIs, CAT scans, x-rays, we'll look at that, and if I think they need surgery, I'll let them know, and I'll direct them in the direction that I think is the best doctor for their type of surgery that they need. If we feel like we can help them holistically, then we'll do that. So there's different types of patients. She may not be a scoliosis patient,
Right.
but she may have misalignments that are interfering with the nerves. We call that as subluxation. And if you reduce down the subluxation and get the pressure off the nerve, then most people are going to feel better. So we still see a ton of patients like that. I graduated from chiropractic school in 1992, so I've been in practice for 27 years. So I've seen thousands of patients, over 10,000 patients. So because of that, I still see patients that don't have scoliosis.
Right.
I've been doing the scoliosis work for 5 years, but I've been helping, people in the community with just their health for a long time.
Yeah,
so we still see a lot of patients, from pregnant women to infants, migraines, neck pain, back pain, low back pain, leg tingling and numbness, or just prevention. People are educated today, so we actually will have people come in that say, hey, I just want to know where my alignment is and what can I do to prevent. I notice my posture is getting bad. I'm worried how that's going to affect me in the future, because people are really educated on these things. Now, especially this time of year, we've actually had a couple people come in off the street that are just like, I want to make sure my spine's as good as it can be because I don't want to wait for something catastrophic to happen.
Yeah. That's the worst.
In some ways, it's similar to dental care. It's like, if you have a cavity, it might not be causing you any symptoms. But if left untreated, one day you bite into a candied apple at the fair, and you call up the dentist, and they're like, "We got to pull that tooth out." And you're like, "Wait a minute, what happened?" Well, only 10% of your nervous system has to do with pain. The other 90% are controlling all your bodily functions. So you can have a lot of things go wrong with your spine without ever hurting, and then all of a sudden you're picking up a feather off the floor, and your back goes out.
Right.
It wasn't the feather, right?
Right.
you had some issues going on before that.
All right, Dr. J. Hartley, thank you for joining me again. We're coming down to the last minute here. This has been, as always, very educational. I like to think that I was a little more versed in here, so things are going smoothly. But regardless, thank you so much for coming in today. Ladies and gentlemen, thank you for tuning in.
Yep.
Make sure you visit Dr. Hartley at his website, You can do online screenings there or schedule an appointment, drjhartley.com. Make sure you follow their YouTube channel, Hartley Chiropractic and Scoliosis Center. We're trying to get to 1,000 followers.
Right. We're going to have a live show from the studio.
Perfect.
All right. Happy New Year.
For joining us. Happy New Year to everyone.